The most dangerous advice people over 60 receive about poor leg circulation is also the most well-meaning. Elevate your legs. Wear compression stockings. Walk a little more. And look, none of that is wrong. I want to say that clearly right now so there is no confusion. You should absolutely keep doing those things. But there is one specific mechanism inside your lower legs that is responsible for physically forcing blood back up to your heart against the full weight of gravity, and most of the standard advice barely activates it at all. I'm Dr. Adrian Vale. I have spent years operating on legs that did not have to end up on my table. Legs that belong to sharp, active, determined people who followed every piece of advice they were given and still watched their circulation quietly deteriorate year after year. They came to me with feet that felt like ice even under 2 pairs of socks in July. Ankles that looked normal in the morning and resembled overstuffed sausages by 5 p.m. A deep, dull ache behind the shin that never quite went away. And a creeping unsteadiness every time they stood up that made them dread getting out of a chair in front of other people. These were not sedentary individuals. They were trying. They were frustrated. And the thing that frustrated them most was that nobody had ever explained to them why their efforts were not producing results. Let me explain why this matters far more than most people are willing to admit. Poor leg circulation after 60 is not simply an inconvenience that makes your feet cold at night. It is a slow, quiet process that steals your independence one small step at a time. When blood cannot move efficiently through the lower extremities, oxygen delivery to the tissues drops. Wounds that should heal in a week take months. A small cut on the foot becomes an open sore. An open sore becomes an infection. And an infection, in the worst cases I have seen, becomes an amputation. It is also one of the body's earliest signals that the cardiovascular system as a whole is under serious strain. By the age of 70, roughly 1 in 5 adults has peripheral artery disease, a narrowing of the arteries that supply the legs. The majority of them have never been diagnosed. They assume their symptoms are simply what getting older feels like. They are wrong. And the earlier you intervene, the more you can change the trajectory. Now, before you assume I am about to tell you to walk more or drink more water, stay with me for just 2 more minutes. Because the reason your feet are still cold tonight, the reason your ankles still swell despite everything you have tried, comes down to a single muscle group that most people never consciously engage even once throughout their entire day. And once you understand how to activate it properly, the solution is far simpler and far more effective than anything you have been told before. Let me tell you exactly what I am talking about. Your calf muscles. Specifically, what vascular surgeons call the calf muscle pump. We refer to it as your second heart, and that is not a poetic exaggeration. It is a literal mechanical description of what your calves do. Every time your calf muscle contracts fully, it squeezes the deep veins running through your lower leg, like a hand squeezing a tube of toothpaste. Blood gets pushed upward. Tiny one-way valves inside those veins slam shut behind the surge of blood so it cannot fall back down. That squeeze, that valve closure, that upward push, that is the pump. That is your second heart beating. Now here is the problem. After 60, 3 things happen simultaneously. The walls of your veins become softer and more elastic, which means they stretch under pressure instead of holding firm. The tiny one-way valves begin to weaken and leak, which means blood can slip backward. And the calf muscle itself loses mass and contractile force, especially if you spend significant portions of your day seated. The pump becomes weaker at precisely the age when you need it most. Blood begins to pool. Fluid leaks into the surrounding tissue. Swelling builds. Oxygen delivery drops. Skin becomes fragile. And because the discomfort discourages movement, you sit more, the pump weakens further, and the spiral tightens. Most people are somewhere on that spiral right now and have no idea. Here is what I want you to understand. The fix does not require more steps on a pedometer. It does not require expensive equipment or a gym membership. It requires a handful of very specific movements that physically contract the muscles responsible for pushing blood upward. I am going to walk you through 5 of them, counting down from 5 to 1. Each movement does something the one before it cannot, and the single most powerful exercise, the one that vascular rehabilitation centers around the world build their programs around, is number 1. If you remember nothing else from this entire video, remember that one. But you will understand it far more deeply if we build up to it together. One thing before we begin, and it is important to me that you hear this. These 5 movements are one piece of a much larger picture, the daily habits, the nutritional choices, the small decisions that quietly determine whether you are walking strongly and independently at 80 or reaching for assistance at 70. I took everything I share with my own patients about maintaining mobility and independence in these years and organized it into one clear, simple plan. It has already helped thousands of people take control of their health after 60. If you want access to it, the link is on your screen right now. You do not need to write anything down. Now, before the countdown, let me tell you about a man I will call Gerald. He is really a combination of several patients I have treated over the years, so no one's privacy is compromised. Gerald was 68 years old, retired engineer, meticulous about his health. He walked 40 minutes every morning, without fail, rain or shine. He wore his compression stockings. He kept his legs elevated in the evening. And yet, every single night, his feet were cold, his ankles swelled. He had developed a patch of discolored skin near his left ankle that worried him. He sat across from me, genuinely confused, because he was doing everything he had been told, and nothing was improving. Keep Gerald in mind. What finally changed for him is the entire reason I made this video. Let us begin the countdown. Number 5. Ankle pumps. This movement looks so simple that most people dismiss it immediately. That is a mistake. It is often the very first exercise prescribed after vascular surgery, before a patient is even permitted to stand, specifically because it prevents blood from pooling while the body heals. The mechanism is straightforward. When you pull your toes up toward your shin and then push them down as if pressing a gas pedal, your calf muscle contracts and relaxes rhythmically. That contraction and relaxation squeezes the veins and moves stagnant blood away from your ankles and back into circulation. A 2025 systematic review published in the Journal of Orthopedic Surgery and Research analyzed 16 randomized controlled trials and confirmed that ankle pumping exercises improved venous return and reduced lower limb edema in older adults. No standing required, no walking required. Here is how to do it correctly. Sit in a sturdy chair with both feet flat on the floor. Pull your toes up toward your shins as far as they will comfortably go, keeping your heels planted on the ground. Hold for 1 second. Then reverse the motion. Press your toes downward into the floor and lift your heels up as high as you can. Hold for 1 second. That is 1 repetition. Perform 20 to 30 repetitions, 2 to 3 times per day. You can do this while watching television, reading, sitting at the kitchen table, or waiting in the car. It takes less than 2 minutes each time. Consider how much of your day is spent sitting, at meals, in the car, in your chair in the evening. During every one of those minutes, your calf muscle pump is completely switched off, and blood is quietly settling into your lower legs. Ankle pumps turn it back on without requiring you to stand. Walking relies on momentum and forward motion. Your calves barely achieve a full contraction during a normal stride. Ankle pumps force a deliberate, complete squeeze that physically moves blood. Warmer feet, less swelling, less pressure on fragile veins. And because you are seated the entire time, this is one of the safest possible starting points for anyone limited by pain, poor balance, or fatigue. But ankle pumps only wake the system up. The next movement targets the larger muscles higher in the leg. Number 4. The seated leg extension. If you think sitting your leg out in front of you and hold it in the air, you activate the quadriceps across the front of your thigh and the hip flexor muscles at the front of your pelvis. These are the exact muscles that allow you to rise from a chair, climb stairs, and catch yourself when you stumble. When they contract, they compress the large veins running through your upper thigh and help push blood out of the leg and back toward the heart. Normal walking does not challenge these muscles nearly enough to prevent the age-related muscle loss that accelerates after 60. Here is why that matters more than you might think. Geriatric specialists track something called gait speed, which is simply how quickly you walk. They refer to it as the sixth vital sign, placing it alongside your heart rate, blood pressure, and respiratory rate. Because how fast a person walks turns out to be one of the strongest predictors of fall risk, functional independence, and overall longevity. When walking speed declines, it is often one of the very first measurable signs that the body is losing the strength it needs to maintain independence. Strengthening the muscles responsible for carrying you is how you push back against that decline. Here is how to perform this movement. Sit tall in a sturdy chair with your back pressed firmly against the backrest and both feet flat on the floor. Slowly straighten one leg out in front of you, lifting your foot until your knee is as straight as is comfortable. Hold for 2 to 3 seconds, then lower your leg back down slowly and with control. Do not let your foot simply drop. That is 1 repetition. Perform 10 to 15 repetitions on one leg, then switch to the other. The detail that most people miss is the back. Keep it pressed against the chair throughout. This prevents you from rocking your torso or using momentum, which forces the correct muscles to do the actual work and creates the compression that improves circulation through the thigh. As this becomes easier over time, add gentle resistance. A light ankle weight of 1 or 2 pounds or a resistance band looped around your foot is more than enough. Muscles respond to progressive resistance at any age, and older adults frequently improve faster than they expect because they are beginning from a lower baseline. This movement strengthens the muscles that keep you walking independently and drives blood through the upper leg in a way ankle pumps alone cannot reach. But strong thighs will not protect you if your balance system is failing. That brings us to number 3. Number 3. The supported calf raise. This is the movement that trains your circulation and your balance simultaneously. And balance is one of the single most important factors determining whether a person maintains independence or gradually loses it. The National Institute on Aging states clearly that keeping the lower body muscles strong is one of the most effective strategies for preserving mobility with age. For continuing to rise from chairs, climb stairs, and move through daily life without assistance. Your calves sit at the center of that process. Every time they contract, they squeeze the deep veins or force blood upward. When they are weak, blood pools, swelling increases, balance reactions slow, and an ordinary stumble becomes far more likely to result in a serious fall. Let me pause here for one moment, because I have a small favor to ask. If you are finding this information useful, please subscribe to the channel, tap the like button, and leave me a comment telling me which of these 5 movements you plan to begin with today. I read every comment personally, and your feedback directly shapes the videos I create next. Now back to your calves. To perform a supported calf raise, stand behind a sturdy chair or at your kitchen counter with your hands resting lightly on the surface for balance. Place your feet approximately hip-width apart. Slowly rise up onto the balls of your feet, lifting your heels as high as is comfortable. At the top, pause for 2 to 3 seconds. Keep your eyes looking straight ahead rather than down at the floor. Then lower yourself slowly, taking a full 3 seconds to return your heels to the ground. That controlled tempo and that brief pause at the top are where the real benefit occurs. They force your calf muscles and your balance system to work together, which is precisely what your body must do when you catch yourself mid-stumble. Start with 10 repetitions. Over several weeks, build up to 20 or 25. This single movement improves ankle stability, circulation through the lower leg, and neuromuscular reaction speed simultaneously, and it accomplishes all of that without placing excessive stress on the knees or the hips. For many of the patients I have treated over the years, this was the exercise that first made them feel genuinely steady on their feet again. But standing on 2 feet is the easier version. The next movement takes one of them away. Number 2. The single leg stance hold. Before you dismiss this as purely a balance exercise, with no relevance to circulation, let me share a number that permanently changed how I think about it. In 2022, researchers published a study in the British Journal of Sports Medicine that followed more than 1,500 adults over several years. They found that people who could not stand on one leg for 10 seconds had an 84% higher risk of dying from any cause during the follow-up period compared with those who could. 84%. And among adults in their early 70s, fewer than half could pass that test. A 10-second balance assessment predicted future health outcomes more powerfully than nearly any other single measurement those researchers took. You can try it right now. Carefully. With a kitchen counter or a sturdy chair beside you, stand tall. Keep one hand hovering close to something solid you can grab if needed. Lift one foot just an inch or two off the floor and see if you can remain steady for 10 seconds without holding on. That is the test. And it is also the exercise. The reason it improves circulation is simple. Time. The instant you stand on one leg, your calf, ankle, hip, and core muscles must all contract and continue contracting to maintain your balance. That sustained contraction keeps your calf muscle pump engaged for the entire duration, pushing blood upward continuously instead of allowing it to settle into your foot. During normal walking, you are on one foot for a fraction of a second before transferring to the other. The pump never stays engaged long enough to create meaningful sustained pressure. Standing on one leg forces it to remain fully active. This is where circulation and fall prevention become the same thing. When balance declines, people instinctively move less. Less movement means less blood flow. Less blood flow means more swelling, more pain, colder feet, and less confidence. Less confidence means less movement. The spiral continues. To practice this safely, stand beside a counter or wall, with one hand resting lightly on it. Shift your weight onto one leg and lift the other foot just an inch off the floor. No higher. Stand tall. Look straight ahead. Do not curl your toes to grip the floor. Hold for 20 to 30 seconds while breathing normally. Then switch legs. That is one set. Begin with 2 sets on each side. As the exercise becomes easier over weeks, gradually reduce how much you rely on your hand for support until you can hover it just above the counter without touching. That sustained muscle engagement keeps blood moving efficiently and retrains your nervous system to respond more quickly when you lose your footing. But balance alone, while critical, does not fully restore healthy venous circulation on its own. For that, you need the most powerful version of the calf muscle pump. And that brings us to number one. The standing calf pump hold. This is the movement I promised you at the very beginning of this video. And once you understand what it is doing inside your leg, you will immediately understand why vascular rehabilitation programs worldwide build their protocols around it, the same way a cardiologist builds a protocol around a medication. It looks almost identical to the supported calf raise from number 3. Almost. There is one small difference, and that difference changes everything. The hold. You rise up onto the balls of your feet, and you stay there. You do not come back down immediately. You remain at the top with your calves, fully contracted for a sustained period. Your calf muscles function as powerful pressure chambers, and holding them in full contraction keeps those chambers compressed long enough to clear the blood that has been pooling around your ankles and drive it forcefully back up toward your heart. Ankle pumps wake the system up. The single leg stance trains control and balance. But the standing calf pump hold moves the greatest volume of blood and sustains that movement for the longest duration. It is the most mechanically efficient activation of the second heart that you can achieve without specialized equipment. The evidence behind this movement is concrete. A randomized clinical trial, published in the Journal of Vascular Surgery, found that patients with poor leg circulation who followed an exercise program built around calf raises significantly increased their pain-free walking distance. Their total walking capacity improved by nearly 100 meters, without medication, without surgery, without any equipment beyond a surface to hold for balance. That is the calf muscle pump doing precisely what it evolved to do. Here is how to perform it safely. Stand behind a sturdy chair or at a kitchen counter with your hands resting lightly on the surface. Place your feet approximately hip-width apart. Slowly rise onto the balls of your feet, lifting your heels as high as you comfortably can. Now hold that position at the very top for 3 to 5 seconds. Do not let yourself sink down. Keep breathing normally. Keep your eyes focused straight ahead. Then lower yourself slowly, taking a full 3 seconds to return your heels to the floor. That is 1 repetition. Begin with 8 to 10 repetitions. Gradually build up to 15 or 20 over the course of several weeks. Always perform the movement with complete control. Never rush through it. The hold is the entire point. That sustained maximal contraction keeps the calf pump fully engaged, forces blood upward, reduces swelling, and strengthens the precise muscles your body depends on to keep you upright and moving. Because there is no jumping, no impact, and no pounding involved, this exercise is gentle enough for most people with joint pain or reduced balance, provided one hand remains on a stable surface for support. Now let me tell you what happened with Gerald, because this is where it all came together for him. I had him stop fixating on his step count. Instead, I asked him to perform these 5 movements in sequence for about 12 minutes each morning. He began with ankle pumps while sitting in his kitchen chair, then seated leg extensions. While his coffee brewed, he moved to supported calf raises at the counter. After that, single leg stance holds. And he finished with the standing calf pump holds. I am going to be completely honest with you about his results because I always am. His circulation did not transform into that of a 30-year-old overnight. I would never promise anything like that, and you should be skeptical of anyone who does. But within 3 weeks, the swelling that had plagued his ankles every evening began to diminish noticeably. His feet felt warmer when he got into bed at night. The discolored patch of skin near his ankle stopped getting worse and slowly began to improve. And the thing he told me mattered most, more than any of the physical changes, was this. He no longer felt that lurching moment of instability every time he stood up. He felt solid again. For a man who had quietly been planning his life around the fear of falling, that was everything. Before I let you go, I owe you one important warning. And I would far rather you stay safe than ignore something that requires immediate attention. If you ever develop sudden severe pain in one leg, if one leg becomes pale, cold, or numb without explanation, if you notice a wound on your foot or lower leg that simply refuses to heal despite weeks of care, do not stay home attempting to manage it with exercises. Those symptoms require prompt medical evaluation because they may indicate a severely blocked artery or a dangerous clot, either of which can be a medical emergency. Everything I have shown you today is intended for chronic, everyday poor circulation, not for acute emergencies. So there you have them. 5 specific movements that activate your second heart and physically drive blood back up from your legs where it belongs. A quick recap. Number 5, ankle pumps to wake up the calf muscle pump while seated. Number 4, seated leg extensions to strengthen the thighs and move blood through the upper leg. Number 3. Supported calf raises to improve circulation and balance together. Number 2. The single leg stance hold for sustained muscle contraction and stronger balance reactions. And number 1. The standing calf pump hold, the single most powerful movement of all 5, and the one I would choose without hesitation if I could only recommend one exercise for the rest of your life. And by the way, keep walking. Walking is a genuinely excellent habit, and I would never ask you to stop. But walking alone leaves an important gap in how effectively your body returns blood from your lower legs. These 5 movements are what fill that gap. They take less than